Hi, and welcome to Doc Talk. I am Dr. Ashley Martinez, also known as Dr. A.
I'm Dr. Regina Vanburg.
And today we're going to be talking to you a little bit about mood and depression, specifically depressive symptoms, and what depression is and what it isn't.
I love how you phrase that. I think about what people come in and very commonly say. What do you hear in your practice when people come in?
So people have said I should come in and see somebody because I'm depressed. I'm like, okay, so what does that look like, right? Is there a clinical diagnosis? Have you met with another psychologist or mental health provider in the past and that's been a diagnosis that was given to you? Or are you just feeling down and your friends have told you that you're depressed, right? Which isn't really the same thing as a clinical diagnosis. And so then we parse that apart, right? What does that look like? When did it start? What's going on in your life? Because it's perfectly normal to have a bout of the blues, right? Especially if you, I don't know, make a bad grade on an assignment if you're a college student. If you are going through a divorce or a pet passes, right? These are normal kind of ebbs and flows. You're going to kind of down, but usually we rebound.
Sadness is the normative response to any kind of loss. So I think, what's really critical here is parceling out when did this start, because that's going to tell us about why. Is there a reason? And then we can kind of gauge, is this a standalone issue, this low mood? Is it happening because it's been happening a lot for you lately? Maybe it's been happening a lot through the course of your life. Or is it new and it's directly related to some event that has happened? It's really important information.
All of that is really important, right? So also even getting away from this idea of like, if you do or if you are diagnosed with clinical depression, that doesn't necessarily mean that you will continuously have this. There is kind of a variation. It could be a life event that has occurred that has led to this single episode, and it could also be that it is something you've been dealing with since maybe you were a kid. Maybe you always remember feeling like this, and you've had these bouts off and on throughout your life, right? And so as you work with providers like us, we would look at that through our own clinical evaluation and then determine kind of the severity of that, the duration, how long it's been going on, of course, collaboratively with your help.
Absolutely. So as you know, part of our intention with this channel is to demystify this whole process. What we've done is we've pulled out our DSM, our Diagnostic Statistical Manual, and we're just going to walk through so that you can watch what we would be doing on our end when we're thinking about, is this a legitimate depression of diagnosis versus maybe something else? So the first two big ones, right? What people are going to be talking about is I have low mood. And this can mean there's sadness happening, or it can look a couple of other different ways, but that first piece is critical, low mood. And then we're going to notice that things that used to be appealing are no longer appealing. So I've lost interest. Things are not pleasurable to me anymore. It's the second really big indicator of depression.
Absolutely. So maybe you're not doing the things. Maybe you're not golfing or you're not going running anymore, and this was a really big part of your life. Those would be really big indicators that something's wrong, right?
Or maybe on the other hand, maybe you are doing some of these activities still, but they just don't do it for you anymore. Something is different about how you're responding.
Absolutely. Other things to look for are significant weight loss or weight gain, which would also mean kind of either increase in appetite, you're eating a lot more than usual, or a decrease. Maybe it's really hard for you to eat and nothing kind of tastes good, and or you just don't feel like eating. Other things to consider are issues with insomnia, right? So either sleeping, difficulty with sleep, so falling asleep, staying asleep, or waking up earlier than you would like.
Or sleeping way more than what would be kind of typical for you prior to this low mood.
And that's key, right? So typical for you, not typical for anybody else. So maybe you're one of these people that only sleeps, 6 hours a night, and now you're sleeping 8 or 9. That wouldn't be typical for you normally. Whereas somebody else that normally sleeps 8 hours, that is normal for them, and they might be sleeping 9 or 10, right?
Absolutely. In the same domain, we might notice that I'm feeling a lot more fatigued than what would be typical for me. And maybe even there's some lethargy going on there too. So I just don't move the same way that I used to. It feels harder. Maybe I'm moving slower, or there's something different about just how I am in my body at this time.
Absolutely. So feeling like I'm moving slower. People might be telling you, you might not even be noticing it, right? So some of these issues with psychomotor agitation. Right. And then other things like potentially feeling worthless, right? Or potentially feeling inappropriate guilt, feeling bad about yourself, having negative thoughts. People don't like me. I'm not good for anything. Just really feeling down about yourself. I'm worthless.
Right. I hear that one so much. I think this is one that when people are having this one in particular happen, they're very likely to come in and report.
Absolutely.
This is part of how I've been talking to myself. This is how I feel about myself. It seems really common to me.
Absolutely. The one that usually doesn't seem as common that people don't link with depression is a difficulty with focus and concentration.
That's right.
They think that it's like, oh, I've got so much on my mind, or I've got a lot of work to do, and they don't realize that it actually can be connected with depression. So this might look like you're reading emails over and over again, or you're reading a passage or a report or something, and it almost feels like it doesn't enter, like it's not sticking, right? And that can be really frustrating for people.
It can also make it very difficult to do things that used to be easy for you, like decision making or tracking something. We find maybe that sense of I'm kind of lost. It's difficult for me to cognitively function the way that I used to.
And then last but not least, we also hear things like people will come in and have thoughts of self-harm, right? Or wishing that they weren't here. And so this isn't the case for everybody. But we are just giving you kind of the spectrum of different things that somebody might experience, and this might be in any combination. We're really looking at this from that perspective to see what it is that the person is going through, what symptoms are they reporting, and how many of these symptoms are they reporting, and for how long.
For how long, right? So what we're looking for, the magic number here is about 2 weeks. Some of these, maybe not all of them, like Dr. A was saying, but some combination of these for at least a 2-week period of time, that's really going to clue us in, like we're looking at something here that may need some form of treatment.
Absolutely. So things to consider, right? If you're noticing that you are struggling, it's been 2, 3, 4, 5, 6 weeks, right? And you are listing like 5 of these things. And guess what? That's probably a really good indicator that you might want to come in and see a mental health provider or behavioral health provider, and that could be a psychologist or that could be a therapist, but somebody to start working on that so that you can get a handle on things.
And I think this is a nice time to kind of come full circle and really just remind everybody out there that sometimes feeling these things, if they happen in the context of an important life event or some kind of loss, it's normal. Right? But it's that context that we're really looking for that we want to bear in mind ourselves, and we want to remind you all to do as well.
And that just because you suffer from it once doesn't mean it's going to be forever. And for other people, it is recurrent. And if it is recurrent, then obviously working with your mental health providers, your psychologist, and even maybe your psychiatrist to get a handle on things, right? Because then it might indicate more of an issue with kind of neurochemicals.
That's absolutely it. All right. Anything else on this you think is important to say here?
I think saying that it's pretty common. A lot of people suffer from it. So really trying to destigmatize this idea of depression and mental health issues, and that there are providers here to work with you to help you through that, to learn the skills that you need, and to help you really lead your best life.
And we both happen to be pretty good at that. So if you have interest in engaging our services for psychotherapy, or if you just want to learn a little bit more about what Anime Monday does, please click the link in the description box below.
And remember to comment, like, and subscribe. So we will catch you all during the next episode. Have a good one.
Thank you.